CNA passive range of motion technique. Welcome to the quiz. Question 1. A resident is refusing to take a shower this morning, stating they are too tired. What is the most appropriate response that balances their rights with their hygiene needs? Option A. Tell them you understand they are tired, and you'll be back in an hour to see if they feel up to it then. Document their refusal and your plan to reapproach. If they continue to refuse, report to the nurse. Option B. Forcefully help them into the shower to maintain hygiene, explaining that it's for their own good. Option C. Give them a complete bed bath without asking, as this meets their hygiene needs without requiring them to get up. Option D. Insist that they must shower because it's on the schedule and hygiene is important for preventing infections. The answer is A. Respecting refusal while offering alternatives and involving the nurse is appropriate. Option A is correct because it respects the resident's right to refuse while offering an alternative later and involving the nurse if refusal persists. Option B is incorrect because forcing care is abuse. Option C is incorrect because providing a bed bath without consent disregards their choice. Option D is incorrect because insisting violates autonomy. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 2. While ambulating a resident, you notice the electrical cord on their roommate's pump is frayed and damaged, with visible wires. What should you do? Option A. Unplug the pump immediately to prevent electric shock, even if it means interrupting the infusion, then go find the nurse. Option B. Finish ambulating your resident safely, then immediately return to the room, unplug the pump if it's safe to do so, and report the frayed cord to the nurse so the pump can be taken out of service and tagged for repair. Option C. Ignore it as it's not your equipment and you are focused on your resident. Option D. Wrap it with electrical tape from the supply closet to make it temporarily safe and prevent anyone from getting shocked. The answer is B. Safety first. Finish your current task safely, then address the hazard. Option A is incorrect because unplugging and pump without considering the infusion could harm the resident. Reporting first allows the nurse to manage the infusion. Option B is correct because you first ensure your resident's safety, then address the hazard by reporting it so it can be properly handled. Option C is incorrect because ignoring a safety hazard is negligent. Option D is incorrect because taping is not a proper repair and could be dangerous. Question 3. When providing hair care for an African American resident, which of the following is a culturally sensitive and appropriate practice? Option A. Brushing their hair vigorously from the scalp to the ends to stimulate the scalp and distribute oils. Option B. Using a pick or wide-tooth comb, applying moisturizing products like leave-in conditioners or oils as the resident prefers, and gently detangling from the ends upward to prevent breakage and respect hair texture. Option C. Suggesting they cut their hair short to make it easier for the staff to manage and maintain. Option D. Washing their hair every day with a strong, clarifying shampoo to keep it clean. The answer is B. Respecting hair care needs specific to African American hair is culturally sensitive. Option A is incorrect because vigorous brushing can cause breakage. Option B is correct because it respects the unique needs of African American hair, which is often drier and requires moisturizing and gentle detangling. Option C is incorrect because suggesting a haircut for staff convenience is disrespectful and disregards resident preference. Option D is incorrect because daily washing with harsh shampoo can dry out hair. Question 4. You are caring for a resident who is incontinent of urine. To maintain skin integrity and prevent breakdown, what is the most important thing to do? Option A. Apply a heavy layer of powder to the perineal area to keep the skin dry and absorb moisture. Option B. Check the resident frequently, at least every 2 hours, and promptly cleanse the skin with a gentle, pH-balanced cleanser. Pat dry thoroughly, do not rub, and apply a moisture barrier cream or ointment to protect the skin from urine. Option C. Use adult-sized disinfectant wipes that contain alcohol to ensure the skin is sanitized and free from bacteria. Option D. Place a plastic-backed brief on the resident and change it twice a day, morning and evening, to minimize disturbance. The answer is B. Frequent checks and proper skin care prevent moisture-associated skin damage. Option A is incorrect because powder can cake and retain moisture. Option B is correct because frequent checks and prompt cleansing with gentle products, followed by barrier cream, is the best way to prevent moisture-associated skin damage. Option C is incorrect because alcohol wipes are drying and irritating. Option D is incorrect because changing only twice daily is insufficient. Wetness against skin causes breakdown. Question 5. A resident who is legally blind asks you to describe the view from their window. What is the best way to respond? Option A. Open the window so they can feel the air and hear the sounds, which is better than a verbal description. Option B. It's a nice day, and leave it at that, as detailed descriptions may be confusing. Option C. Provide a detailed, vivid description using other senses and descriptive words, such as, I can see the bright yellow sun warming the red bricks of the garden wall, and I can hear the birds singing in the big oak tree. The air smells fresh, like it might rain later. There are pink flowers blooming right outside. This engages their imagination and other senses. Option D. Tell them there's nothing interesting to see, so they don't feel like they are missing out. The answer is C. Rich sensory descriptions allow a blind person to imagine the scene. Option A is a good addition but does not replace a verbal description. Option B is too brief and dismissive. Option C is correct because it provides a rich, sensory description that allows the resident to imagine the scene. Option D is dishonest and may make the resident feel excluded. Question 6. You're about to perform a procedure. After identifying the resident by checking their wristband and asking their name, the resident says, My name is Mary, but everyone calls me Susie. What should you do? Option A. Stop and do not proceed with the procedure. Report the discrepancy between the wristband and what the resident said to the nurse immediately. Re-identify the resident using another method, such as checking their photo in the chart, before continuing. Option B. Ask them to confirm their date of birth. If they can do that correctly, proceed with the procedure. Option C. Call them Susie to make them feel more comfortable and proceed with the procedure. Option D. Proceed with the procedure, noting that the wristband says Mary, but it's common for residents to have nicknames. The answer is A. Any discrepancy in identification must be resolved before proceeding. Option A is correct because any discrepancy in identification must be resolved before proceeding to ensure you have the right resident. Option B is incorrect because date of birth may be forgotten or confused. You need to resolve the discrepancy with the nurse. Option C is incorrect because using a nickname does not confirm identity. Option D is incorrect because assuming it's a nickname could lead to wrong patient error. Great job! Don't forget to subscribe. Bye!